When you look across the U.S. today, the opioid crisis is everywhere.
The opioid epidemic is just a tragic situation in America, with more people dying from opioid overdoses each year than AIDS at its height, than breast cancer. I mean, this is a national tragedy. It's an epidemic and a tragedy.
That's painful to hear, right? I mean, that's actually not where we want to see it. But with the tooling, with the data, we can actually do better guidance.
The Surescripts Network Alliance is really critical to pulling together all of the necessary stakeholders to solve some of the greatest pain points we have as an industry.
We need an all-hands-on-deck approach to the opioid epidemic for sure. It's going to take every part of the healthcare ecosystem to play a role, including health information technology.
The biggest thing that we need on the opioid crisis, at least on the prescription side, is the knowledge. And Surescripts provides that to the providers.
So we really have 5 solutions, right, that providers and pharmacies and PBMs can take advantage of to fight this opioid epidemic. EPCS is a much more secure way of routing that prescription from the provider to the pharmacy. Right, so it's more secure, it eliminates paper, so that helps fight against diversion or other fraud.
Getting those scripts through the digital channel can vastly reduce the chances for fraud, waste, abuse, to make sure we're keeping patients safe.
We are a national infrastructure that can supply medication history, a patient's medication history, to prescribers when they're providing care. So actionable intelligence that allows the prescriber to assess whether their patient is at risk of abusing opioids or controlled substances.
This information pops up at the point of prescribing and tells the prescriber, here's exactly what Skelton is on. Here's what the meds are, and they can look at that and say, okay, fine, Skelton's been on an opioid 3 times in the last 6 months. Maybe that's a mistake. Maybe Skelton has a problem he needs some help with. Maybe we just need to have that conversation.
That allows physicians to determine where a patient may be receiving care, and also to get records of the care being provided. So again, more information about the patient, more information about what is happening with that patient, so they can assess whether there's an issue in terms of abuse or potential of abuse.
So we use the Surescripts record locator service as a component of our interoperability strategy. When patients receive care from multiple providers, it's critical that those providers are aware of the work that each other is doing.
Based upon medication history solution, based upon our record locator and exchange solution, they now know who other providers are for that patient, and using clinical direct messaging can communicate in a very efficient and secure way.
Having the ability to send messages directly into the physician's EMR can greatly inform that patient visit. Information maybe about an opioid patient, a patient who's taking opioids, who's seen multiple prescribers that maybe that physician isn't aware of, can greatly inform their treatment plan at that point of care.
And lastly, we have insights and alerts. So these are messages that can be sent to prescribers or physicians, letting them know whether the patient is adherent to their regimen, whether there's new prescriptions that have been prescribed. And again, it's information that now the clinician has about their patient and assess whether or not there's risk of abuse.
The technology exists today, and it's in prescribers' hands today to help make informed decisions about opioids. The tools exist. It's really just making sure that the industry understands how to use them and point them at this particular problem.